Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Today we're going to focus on a very serious mental health topic, and that's suicide awareness and prevention. My guest today is Dr. Vinay Saranga, a psychiatrist and founder of the North Carolina Institute of Advanced NeuroHealth. Dr. Saranga, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Hi, Jeanine. Thank you for having me.
So we're going to just start out by you telling us a little bit about what made you decide to be a psychiatrist in the first place.
It's because I've been practicing now for over 10 years. You know, I grew up in my father was a physician, but he was an internist. And I was interested in the medical field, but my interest was more in talking to people and learning, sitting down with them, understanding what's been going on, and what challenges they're facing in their personal lives, rather than more of the medical side of things. And that kind of that's what attracted me to the mental health field.
Very interesting. So tell me about now North Carolina Institute of Advanced NeuroHealth, and who do you treat? How do you treat them? And what is the placement like there? Well,
so we're located in that's my private practice, and we're located in Apex, North Carolina, which is just a sort of a suburb of the Raleigh-Durham area. Mm-hmm. What we call is the RTP, or Research Triangle Park area. So I'm just outside there. So a lot of the folks that I treat are from the Raleigh-Durham, Chapel Hill area. Mainly. So we are a psychiatry practice, and we treat all ages. I'm a adult psychiatrist, but also board certified child adolescent psychiatrist. I've done fellowship training, specialized training in child and adolescent psychiatry in addition to adult psychiatry. So our focus is typically on diagnosis and treatment of really most of the major mental health disorders or mental disorders, spanning all ages, really from starting at school age, around 5 or 6 years old on up, through the elderly. So we're specialized in mostly, like I said, diagnosis and treatment, including medication management, sometimes figuring out if there's a medicine that can help, for example, in ADHD or depression or bipolar disorder, and kind of deciding that with the patient and families if there's a medicine that would be appropriate. In addition to that, we also provide a treatment that's a non-invasive, non-medication treatment called TMS, transcranial magnetic stimulation, which is basically a machine that's used that uses magnetic pulses to stimulate certain parts of the brain to help treat depression. And also we provide treatment with intranasal S-ketamine, which is basically an intranasal spray that's used twice a week for several weeks to help also for what's called treatment-resistant depression, which is folks who've tried multiple medicines for depression and it just hasn't worked. So these are both those treatments, TMS and intranasal S-ketamine, are intended for treatment-resistant depression.
Those are very interesting. I've never heard of the nasal spray for treatment of resistant depression.
It's a newer option, yeah. It's over the past few years it's developed. The intranasal, that's one formulation of the ketamine or S-ketamine. There's the other common version you may have heard about in the press more is the intravenous or IV infusion.
Right. So I want to get specifically, there's so many topics to cover here, but I want to talk a lot about, or some about suicide prevention and mental health. And talk a little bit to me about what are some of the warning signs that the everyday person would notice if someone is suicidal?
So I would say, some of the obvious signs would be, if the person that you care about is, obviously talking about wanting to die, that would be one thing. And that's fairly obvious. But also along with that, sometimes if they're, perhaps making a plan,
right,
researching ways to die, saying goodbye to people that they care about, withdrawing from friends, family, giving away some of their kind of important items, perhaps even making a will, would be, all sort of obvious signs to most folks that something's wrong and they, that they may need help.
So these are commonalities. Do you find differences across the lifespan? I know that you treat children as well as the older adult. Do you see that there are specific indicators for different age groups? For example, maybe in my child who comes home from school may have different a presentation than would someone who is an older adult. Anything that sticks out?
Absolutely. As you mentioned, I do treat all ages. So a lot of times, depression, especially in teenagers or children, really presents very differently than depression in adults. And a lot of when I work with families, a lot of parents don't realize that because that's not always common knowledge. Because when we think about depression, and when we're talking about suicide here, I'm thinking about depression. Obviously, that it could also be suicide could be a concern, obviously, in bipolar as well. But I'm just kind of just focusing on suicide, on depression for simplicity's sake. But yeah, so in adults, we have the more common symptoms of depression would be changes in mood, sadness, crying spells, changes in sleep and appetite, sleeping more, sleeping less, eating more, eating less. You're talking about guilt, having feelings of guilt, worthlessness, hopelessness. That's more common symptoms of depression in adults. In children, what we notice more is the symptoms are somewhat different from adults, and that's why a lot of times parents struggle with understanding it, because children, especially teenagers, tend to have more what's called more externalizing symptoms, which it can be more. What I mean by that is more like anger outbursts, more irritability, acting out behaviors, maybe getting into more fights in school, or arguments with parents, physical fights sometimes too at home or at school. Sometimes they can act out by using drugs, substances as well. And one of the concerns often in children too is we need to look for a change in grades. If your child's been doing pretty well in school, even if it's A's, B's, or C's, all of a sudden they're starting to flunk most of your classes. That's a concern that something's wrong.
So with people who are suicidal, is it likely that they need to be, if we suspect this, that we really need to get in touch with a professional, or are we just to watch it? I think when do we know that it is escalated to a point where we need help?
Yeah, and that's where that it gets tricky. And really, I mean, unless you're in the mental health field or work in the mental health field or trained in it, you really may not necessarily know when's the right time to seek help. So I would say sooner is better than later, to be honest, to seek help, because you really may not know when is the tipping point for suicide. And sometimes even for those of us in the mental health field, we're really not that great at predicting future suicide attempts or completions. We're not that great at it, and that's because oftentimes it can happen somewhat impulsively. What I mean by that is, there's multiple ways that folks unfortunately can commit suicide using firearms or overdosing on medications. A lot of times, at the time it happens, these these folks may be in really severe pain and may act on those impulses without really thinking it through. And that's where it oftentimes goes wrong. If the person actually was able to think about it, think it through a little bit better, they may not really act on some of those lethal means of suicide. So since really the majority of folks are not trained in the mental health field, I would say seeking help or as early as you can and looking for support. There's different ways that you can seek support. There's the National Suicide Prevention Lifeline, the 1-800-273-8255, which, those numbers, no one's going to remember those numbers, but hopefully one that can be remembered, and what you've probably been seeing a lot about on the news or TV is the 988 Suicide and Crisis Lifeline. So you can call or text 988 or chat at 988lifeline.org. And
that is the number specifically for suicide.
Correct. Suicide and crisis. Yeah. Mental health crisis. Yeah. So I think that would probably be the most important number that folks should remember to reach out to if it's a loved one you care about and you don't know what to do, or for the person themselves if they're struggling with depression or suicidal thoughts, to reach out for help.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're talking about suicide awareness and prevention. My guest today is Dr. Vinay Saranga, a psychiatrist and founder of the North Carolina Institute of Advanced NeuroHealth. So, Dr. Saranga, a question for you. Does mental health run in families? Or is this something that is caused by maybe a catastrophic event or maybe a chemical imbalance? Can this mental health issue, wherever it is, bipolar disorder, suicide tendencies, run in families?
Yes. Well, the answer to your question is it's all of the above. So mood disorders, we're talking about depression, which is unipolar depression. So, and there's also bipolar depression, where there's the opposite. Bipolar meaning you can have manic or hypomanic episodes along with depressive episodes. Unipolar depression is just folks who just have depression only without the manic or hypomanic episodes. So it's multifactorial for both. Meaning, yes, there's a genetic predisposition. There's a genetic component if parents or grandparents have it. There is a biological component too. Which multiple theories on depression right now, or what causes depression. There's several neurotransmitters that may be involved in the brain, including dopamine, norepinephrine, serotonin, and then there's also situational, social, psychological factors that can be involved. So, and that can be many stressors for folks. Divorce, losing a family member, a death. In kids, bullying is obviously a huge issue. Now it's more cyberbullying, unfortunately. And substances can be also a risk factor. Substance use, which can worsen mood symptoms as well. So
after someone has attempted a suicide, should I treat that person differently, or should they be on high alert? Can they go back home, and assume their regular lifestyle, or is this person always someone that I need to watch, if you will, once they've attempted?
That's a complicated question. It's I guess that would be more of a case-by-case basis, depending on the severity of the suicide attempt and their history of, if they've attempted suicide before, that's a risk factor for future suicide attempts as well. So that's really, I would say we need to defer that particular recommendation to hopefully the mental health person that's treating them at the time, because they're really spending the time, whether it's a psychiatrist, and oftentimes I know a lot of folks don't understand the difference between a psychiatrist and a psychologist. So a psychiatrist typically it is a physician who's gone to medical school, is MD or DO, someone who's typically who had medical training in mental health and usually typically medications. Psychologists can be various different degrees, PhDs, PsyDs. And they don't have a medical background, but they're typically involved in more sometimes psychological testing or psychotherapy side of things. So I would have to listen to who's treating the person for their recommendations on what to do and how to monitor that particular patient. I would say, obviously in all cases you would want to make the household as safe as possible, meaning, reducing the access to means to be able to attempt suicide again, or complete suicide for that matter, meaning obviously all firearms should be locked away at home, double locked really. And this is for all ages, so we want to do the best at medications too, especially if that person's been thinking about overdosing. You would likely want to lock away all medications at home too. So doing as much as you can to keep the home as safe as possible. Now, the question about watching them all the time, that's a gray area issue, because if you're feeling like you need to watch your loved one all the time, are they safe to be at home? That becomes a question. Or do they need to be hospitalized? And that's really, that judgment call is best made by a mental health professional.
Yeah, I'm noticing, particularly in New York, a lot of mental health facilities have closed. And I am seeing more and more people that have mental illnesses now homeless on the streets. Are we able to care for these people? Are we able to treat them? And what are your thoughts about the mental health clinics closing, and how do we care for people who have these kinds of issues?
Yeah, obviously there's several factors in that piece going to when we talk about politics, but also funding issues for those particular facilities, and there was some defunding of state mental health institutions as well. So folks that had been hospitalized for years are now not able to be in the hospital, and so they're kind of out and about, unfortunately, even though they have severe mental illness such as schizophrenia or severe bipolar disorder. I'll say that we're doing the best we can in that particular situation. So there's other programs aside from just being in the hospital, inpatient or state psychiatric facilities where patients would stay in the hospital for a certain period of time. Now, usually typically inpatient stays are maybe about a week, maybe 2 weeks. On average, I would say about a week, which is not very long. Right. Obviously, they used to be able to stay in hospitals for months. Yeah. So now there's other programs that are kind of a go-between inpatient and regular outpatient programs called intensive outpatient programs or partial hospitalization programs, where they still stay at home. The patients still sleep at home, but they go in to therapy, several times a week, along with oftentimes meeting with a psychiatrist at least once a week. And these programs can go on for sometimes several weeks at a time. So we're doing the best we can. There's other programs available for, depending on the age group. In children, there's sometimes programs called intensive in-home therapy programs, where the therapist actually goes out to the family's home to at least once a week, sometimes more than that, to kind of do therapy at home. And there's also programs similar to that in adults as well, called ACT, assertive community treatment programs, which are typically more geared towards severe and persistently mentally ill patients, which is when diagnoses such as bipolar disorder or schizophrenia. So where the therapist, the psychiatrist, there's a whole team that goes out to the patient's home to on a regular basis to assist them with medications and therapy and anything else they need.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're talking about suicide awareness and prevention. My guest today is Dr. Vinay Saranga, a psychiatrist and founder of the North Carolina Institute of Advanced NeuroHealth. So just changing gears a little bit, doctor, I want to know, how can we generally keep our mental health well? What can we do at home, just everyday people, to just mentally declutter, to stay above board positive? What can we do? Diet, anything you have to give us?
Absolutely. I mean, that's, and there's multiple pieces to that piece. Yes, diet. You mentioned diet. So eating a healthy, well-rounded diet, avoiding, too much sugary or fatty foods is important. Sleep is also equally important, making sure you're getting enough rest at night, because too much or not enough sleep can affect mood as well. Exercise, regular exercise, I would say at least 2 to 3 times a week of 30 minutes of kind of more or less, cardiovascular type of exercise would be important, in addition to resistance or strength training. For many, now one of the challenges is also screen time. And that's affecting all of us, from children, teenagers on to adults. What's the concern there? I mean, one, it can affect sleep, because a lot of us, including children, are kind of staying up late, looking at their phones, and the light and stimulation from whatever you're using, whether it's social media or watching movies or whatever, can affect your sleep. In addition to the light, so that's what's disrupting our sleep some. And also, we're not giving ourselves a kind of a break from electronics, to kind of unwind as well. So that's equally important. And alcohol, I would say in moderation. Obviously, we don't want to go overboard with alcohol. I know most, many folks may have, a glass of wine, sometimes on the weekends, or maybe a couple glasses of wine with dinner. But I would just say within moderation. So, and many folks, I would recommend too, if you're able to do it, and even if you don't have time to do it, is probably when you should do it, is doing some mindfulness training. And by that, there's several apps available now, Calm, Headspace. And this is just simply like a 10-minute sort of mini meditation, doing some breathing exercises that can help calm your mind and clear your head.
Now, question. I know you're a psychiatrist, and I know that we always are encouraged to see our primary care provider on an annual basis. How important is it for us to get an appointment with a psychiatrist to give us a little check as to how we're doing on our mental health level? Or is it just episodic when we have an issue? Do we come to see the psychiatrist?
And I think, Jeanine, you may be referring to, if I understood correctly, is more preventative in a preventative way. Yeah. Well, I think if you, so psychiatrists, as I said, for the most part now, we're focused on medication management. Yes, we can diagnose and refer out to therapy, to a therapist, if we don't think medication is going to be helpful in that scenario. I think oftentimes you could probably start with a check-in with probably a counselor. Okay. If you think you just want to know if there's anything going on, or if there's anything more that you need to talk about, because they're really going to be kind of the best place to start, to just kind of get some feedback, talk about what's been going on in your home or work life, and see if there's anything you could do that's better to help you. If you may be having some marital issues, for example, there's other folks that marriage therapists that are available that can help you too. So. And that, if that's what you're wanting, is more from a preventive standpoint of a kind of a quick check-in, that would probably be the best place to start, I would say. Psychiatrists, we can do it, but they're often pretty busy, working with patients with a medication. So if you don't feel like you're quite at that point, or that if for some reason you're against medication or you don't feel like you need it, a psychiatrist may not be necessarily the best first step.
So how can someone find out more information about you?
I would say probably an online search is probably going to be the best place to start. My website is NeuroHealth.com, or simply you can search my name, Vinay Saranga, MD, and you'll find my practice link should be towards the top there. And that'll probably be the best place to start.
Yeah. Now, I know you deal a lot with medications, and you mentioned a lot the beginning of the interview. What do you think about the side effects of these medications? Do you find that they are just as create, the symptoms that probably could be disturbing and interrupt their lifestyle of a patient just as much as the disease process? Or do you find that the medications really do help without many side effects that will be detrimental to a person's lifestyle?
Well, so there's several medications that we use to treat different mental illnesses, and some medications, I'll say, do tend to have more side effects than others, and oftentimes we need to have, and this is what we as psychiatrists do as well when we're talking to patients or families about the medication. It's a cost, it's a risk versus benefit analysis. So what I mean is the risk of whatever side effects of the particular medication less than the benefit of it. So is the benefit of being on the medicine greater than the potential side effects or risks of taking the medication? Yeah. And like I said, for some medications, such as depression medicines, many of them really they have very minimal side effects, to be honest. But their benefit in treating depression and helping patients with their mood is quite good. So they can be quite helpful with very few side effects for the most part.
So this has really been a very enlightening interview, both for mental health as well as suicide. And thank you for sharing that suicide prevention number. Thank you for being here, Dr. Vinay Saranga, a psychiatrist and founder of the North Carolina Institute of Advanced NeuroHealth. We want to thank you for giving us this very important information, and we hope that you continue to stay healthy. And thank you for being our guest today.
Thank you for inviting me, Jeanine. A pleasure speaking with you.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.